Okay, well, good morning, everybody. Thank you so much for joining us. Reopen Connecticut Arts Venues through Science-Based Safety. If you're up here in New England with us, it's crazy weather. Hope you all are having great weather somewhere else in the country. Today, we're going to talk about moving forward and how we can get folks to return to your venues. I'm Eric Dillner, the CEO of the Shoreline Arts Alliance and the chair of this task force. If you're just joining us for the first time, our goal is to offer clarity, practical scientific advice, and an opportunity to ask questions related to your own risk reduction strategies in your workplace and in your artistic spaces. This is a listening and sharing platform, and we're here to help you build consumer confidence through science. We, of course, want you to feel free to share the information broadly with all your colleagues. And I want to say thank you so much to some of the folks who have helped us along the way. The Emily Hall Tremaine Foundation, the Connecticut Office of the Arts, Connecticut Community Foundation for Greater New Haven, Connecticut Humanities, and the Community Foundation of Middlesex County have all stepped in as major partners with our big friend and huge partner, Yale School of Public Health. Sten and Crystal, thank you again so much for your gifts that just keep coming. We can't thank you enough. So we encourage everyone to attend each of the webinars and follow Shoreline Arts Alliance's YouTube channel and Facebook for additional information. You can also find information at www.shorelinearts.org. Now, if you feel like I'm going really fast, that's my goal, because Sten told me the list of questions we have today really is about a 2-hour conversation, not a 1-hour conversation. So the goal is to get to the meat of this. I should also say, though, that if you'd like, closed captioning is on, so you can turn it on or off throughout the process. Please use our chat for sharing resources and the Q&A for asking questions. I'd like to introduce you my co-chair, Sten Vermund. Sten is the Dean of Yale School of Public Health and holds the Anna M.R. Lauder Chair in Public Health, as well as a secondary appointment in pediatrics in the Yale School of Medicine. We also have with us today Crystal Paulette. Crystal is an assistant professor in the Department of Environmental Health Sciences of the Yale School of Public Health, and she holds an appointment in the School of Engineering and Applied Sciences. Her specialty is in indoor spaces. So again, we're so honored to have you both with us in all that you've done and to share this information with our Connecticut friends and our partners nationwide. So we're here to help find success for all of you. And help find a way to help you make your decision. So today, we did a survey last week to ask arts leaders what are their continued challenges, and many of their major obstacles are. I guess I'll list them out for you to help us frame today's conversation. So they are enforcing COVID protocols, reluctant audiences, fewer volunteers reluctant to endanger themselves, hesitation to require vaccination proof, lack of training in the front house of staff to handle conflict, funding, getting artists back to audition, actually, just to come back in many ways, and uncertain transition into the endemic phase. So needless to say, we have a lot to cover, but let's start again with our basics. Stan, if you don't mind, just a quick, where are we? What does the current data indicate regarding the prevalence and transmission of COVID-19? Ben?
Thanks, Eric. Nice to be with everybody again. We have good news, which is that thanks to high vaccination rates in the Northeast, and also thanks to the very infectious Omicron variant that kind of has swept through our region with a high degree of efficiency, we may have achieved a sort of herd immunity such that we're going to have difficulty with viral variants sweeping through with the vigor that Omicron and Delta did. So it's good news that the immune systems of most of us on this call, probably nearly all of us, are more robust in facing a future coronavirus challenge. And vaccines and prior infection don't necessarily prevent future infection, but they certainly blunt the severity of future disease quite dramatically. So we have an interesting shift in messaging And that shift is, how do we get back to a near normal circumstance where people feel comfortable sitting in a theater next to somebody, where they feel comfortable coming back to live music events, where we rebuild confidence that there is little to fear. Now, coronavirus rates in Connecticut haven't been this low in 7, 8 months, and they just go down just about every day. Our hospitalization rate for the Yale New Haven hospital system, 5 hospitals, is lower than it's been in many months, and it just keeps dropping. So we are in a very much better place. And when you do have hospitalized people, they're almost all unvaccinated persons. So at the end of the day, we are now in a position to seriously plan a return to normal, and maybe those little plastic circles in the museums asking people to stay 6 feet apart can be lifted off the floor. Maybe we don't have to have seating with physical distancing anymore. For the time being, I would recommend continued mask use, but a month from now, we may not need continued mask use, and we may have some guidance from the CDC as early as next week. So I'm going to let Crystal comment on what she would do on the air quality elements of reform, because let's be honest, a lot of these air quality improvements cost energy. You might ramp up your HVAC systems. You might have a lot of portable air filters, et cetera. And should we continue that level of air quality, even though it costs us energy costs? And I'll let Crystal give her view on that. So at the end of the day, we're in so much better place now than we've been in the last 2 years. I personally feel very comfortable going out to dinner, very comfortable going to a show. I know that as a fully vaccinated, boosted individual, the risks that I have of serious disease are low anyway. But on top of that, I know that the probability that I will encounter an infectious person has plummeted. So that's like a double benefit. So to summarize, I think we need to start rebuilding confidence. I think we need to start with our live programs, almost as if there hadn't been a pandemic. I think we should be using masks for at least another month until we have a better sense of how low a nadir we hit with coronavirus. But there will be a point where we don't need those either. Now, we are keen to ensure safety in our audiences, but if there's herd immunity, what does that actually mean? That means that you're protecting the people who are vulnerable, like the unvaccinated or the immunosuppressed. And if there's no circulating virus, then there's no reason to check vaccine status, because you simply don't have enough circulating virus in the community to warrant that. When we started opening up Schubert Theater for the Yale, the New Haven Symphony Orchestra in the middle of an Omicron surge, well, then physical separation, masking, and checking vaccines made perfect sense. But if there is no Omicron surge, if there's very little circulating virus to begin with, then one could rationally decide to forego vaccine checks. So I think you all know me by now, having spent many of these webinars together. I don't consider myself a Chicken Little, the sky is falling, but I also don't consider myself a Fox News representative. So I'm trying to give you a balanced public health perspective based on the science, not based on philosophy or ideology, but based on the risks that accrue to you as staff and leaders and to your patrons and to your other staff. And when that risk is very low, then I want to say that to you and reassure you that return to normal seems imminent. And I think we're going to have a huge boost with the warm weather. And I think you're going to see low rates go even lower in March and April. So those of you planning summer events may be able to say, oh my goodness, can I really have a normal summer? And my guess is, yes, you can.
Well, that sounds like all great news, Sten.
It is good news.
Thank you. Thank you so much for that. So we as arts leaders have to be proactive on the cautious side, if you will, also of where we are, so that we keep that consumer confidence with all those who are still concerned about the future. So I hear you're saying that vaccinations, masks, we can really lower some of that information. But really, if you were the arts leader running an arts institution where a lot of your folks are immune compromised, older, do you think we should hold out a little bit longer with any of these protocols? In other words, really today, if we were having an event tonight, what would you say the protocol should be?
Tonight, I would say check vaccine cards and masks, because we are still at the tail end of a substantial Omicron surge. We still have people on ventilators at the Yale New Haven Hospital and hospitals throughout the state. It's just a little too early. But I am, as you know, my crystal ball, it's not as cloudy as it used to be. And it is starting to drop at such a precipitous rate. It strongly suggests that we have herd immunity phenomenon operating in the state, because we still have 15% of adults and a higher percentage of children not yet vaccinated. But despite that large pool of unvaccinated people, we still see radically declining rates. Now, many of those people who were unvaccinated got Omicron. They got coronavirus, whether they know it or not. And so they have some infection-induced immunity, and that's what I mean by herd immunity. But I also would love to hear from.
Oh, go ahead.
No, I would love to hear from Crystal on what she would recommend with air quality approaches and things like surface sanitation, that sort of thing.
Absolutely, Crystal. Should we jump there for a minute? So, that's a big question for all of us. We've spent so much time thinking about ventilation and what we should do. MERV 13 filters. Should we be changing them now, since maybe it's they're full of. We had a question that came in that was something like, so we've caught the virus, it's all in our filters. Should we now change the filters out because things are cleaning up?
Yeah, there's the lineup of questions. There were so many of them, and they were all excellent. So perhaps before we dive into all those questions, I'll just mention that the continued discussion of indoor air quality is one that we should be thinking of well beyond COVID's. It is something that we acknowledge to be important to remove respiratory viruses like SARS-CoV-2, and bringing people back into the theater, into the facilities, can be reinforced by having good air quality and having visual metrics to show them how that air is being handled. And I can share some ways that, and we've discussed these in all the previous webinars, on visual cues that can be set, that even if they're not wearing masks, that they can be reassured that it is still being acknowledged as an important parameter that's being managed by facilities.
Great, excellent. Well, so we'll get to some more of those questions here in a minute. I know that Darren has a question about the schools for teaching artists. Darren, you want to ask that question, and I think we may get an answer from both Crystal and Sten on this.
Sure. as a teaching artist for the state of Connecticut, we're right now in about 5 to 6 different schools and school districts. And the teachers and all the other artists were very intrigued about the new mask mandate changes coming down for the schools. How do we stay safe in those schools? And how do we help navigate that jumping from district to district?
It'll be helpful to get CDC's guidance next week. The governor kind of kicked the can down the road by simply saying, okay, the pandemic is low enough in the state that I'm letting the school boards make the decision. So now we've got a patchwork quilt. Most of the school boards are continuing mask use, which I think is prudent until spring break. But I think a lot of them will give up masks after spring break because I think rates will be very low at that time. And that's all perfectly logical. And we're going to get some CDC guidance. CDC has been a little on the conservative side, erring on the side of public safety. So if they say something radical like, we don't think you need masks anymore, that's kind of like me saying it. You know, we're public health people. We're trying to keep people safe. So if we don't think you need to do something, you probably don't need to do it. So I think you're going to see some guidance within the next probably 10 days that will be helpful from CDC. I don't know what they're going to say because I'm not on that panel, but I'm going to be reading that very carefully. And Eric can certainly distribute that when it comes out. And then I think the reality of what we're up against, we are going to, I think, be liberalizing mask use in schools in the very near future. And I think if we're not using them in the schools, rates of transmission are exceedingly low. Hospitalization rates are even lower. One could argue, why are we wearing masks in the theater? And that's a perfectly reasonable argument, and you could forego them at that point.
So really, Stan, just to make sure I understand, Darren, your question from your field is, as you're a traveling artist, town to town, school to school, should the mask mandate continue to move forward on, we don't need it anymore? Are you thinking that there's a concern that artists still feel that they may need to, or it would be safer for them to wear them? Is that where the question is coming from?
Well, I think it's a little bit of both, because where we jump from Norwalk to Ashford to Colchester, and since it's left up to the town, all of a sudden we could be in a school that's unmasked and then into one that is fully masked, but we don't want to be the typhoid Mary, and we're doing the testing and we're doing all that, but it's also, we're the one that connects all those towns in a way. So how do we stay safe and keep all the people that we're working with safe? And that was sort of part of the question. But also, one of the things I read is that the CDC is releasing their less restrictive guidelines potentially today.
Oh, really? Okay.
Yeah, I read that in I think it was some article this morning. So
okay, well, that would be interesting. I heard next week, but today is almost next week.
Right. So, okay, well, good.
Well,
Crystal, anything to add there? I know you spent a lot of time with mask studies and all that air quality. How do you feel about these artists traveling from school to school? How do they stay safe?
So, the difference in guidelines between districts is definitely challenging. If there is concern, we've talked about a host of different measures controls that can be brought with you to maintain confidence within your staff. Things like carbon dioxide monitors that you can just bring into the classroom, battery operated, very small. And this can give you a cue to say, if occupancy is high, maybe that's a time that you would prefer to wear a mask. open a window as the weather allows for, or just bring a very small air cleaner with you that you can place in the side room that's not very loud.
Oh, those are great ideas. Yeah, to keep feeling safe and keeping the air quality good. So
But
Judith,
back to Darren's point, though, this notion of the itinerant teacher or musician or artist, if rates of transmission are low, rates of transmission are low. And that would be more in the face of sort of Windham County having a major outbreak and it's all quiet in Hartford and New Haven, which I don't see happening. So I think that if there were hot spots in the state, then fastidious mask use for anybody entering those hot spots would make sense. But that's not how the pandemic has played out. We've had hot spots, but it only lasts a week and then it sweeps through the state. So I think that when you see the state going yellow and green by township, that's what's happening now. And I think you're going to have low transmission here and low transmission there. And happily, with the exception of the state of New Hampshire, all the other states in the region, including New York and New Jersey, are at the upper echelon of vaccine coverage, and I think that we're doing much better as a region than the rest of the country is.
that's great. We have a question in the Q&A from Mary that says, "Where is the best place to get information about our area to see if there is a spike in the virus?"
I'll pull up the state map and I'll drop it in the chat.
Okay, great. Thank you. Judith, would you like to ask any questions about staff?
Yeah, right now, what areas do you feel our staff should stay focused on as they interact with our public? I know that can change in a very short period of time, but as of right now, what would you suggest that we do as we interact, our staff itself do as they interact, as far as what protocols we should follow?
Well, I think it's reasonable to stay the course of masking and some degree of physical distancing. We think 3 feet's good enough. You don't need 6 feet. And I think for the time being, because we're on that tail end downhill of a very bad, severe outbreak. I mean, there were more people killed in this Omicron wave than were killed in the original wave way back in March, April of 2020, because there were so many people. Even though Omicron wasn't as serious, there were so many more people who got infected. So the absolute numbers of severely ill people went up. But that's declining now. So in about a month, I think we can start going to work as normal. And I don't think masks will be a necessity. People who would prefer to wear masks as an extra personal precaution should be encouraged to do so. There should be no stigma, or, the last thing I would ever do is make fun of somebody wearing a mask, because they have their reasons to want to wear a mask, and I think that should be respected. I myself might wear a mask more than the average person. So, but I think we'll be looking at normality.
Thank you.
I dropped
Not
the
to just continue
data
to handle this
tracker
question.
in the chat.
Yeah, I know this is such a, we keep kind of going back to the question, but great questions are coming up. So cultural sites with national and international guests, should that change our opinion on this? The theaters that are bringing people from around the country and around the world to see a show, does that change our perspective if it's not really a New England based visitorship?
Well, if we stay with our vaccine requirements, and we're asking the opera singer from Houston to be fully vaccinated and boosted, I think it does change our attitude. In other words, that person is minimally likely to transmit to us, and our rates are the lowest in the country, and we're going to minimally translate to them. And I feel like we have thoughtful and reasonable precautions. So for those of you who are at your computer, not on your, can you see my map right now?
Yes, absolutely.
So I don't want you to panic when you see this map. All these red townships have plummeting COVID rates. They haven't quite reached that 15 or more. And if you hover over the map, you'll see here's Madison 24. That's like 1/4 what it was a couple months ago. You see Guilford 25, Farmington 17. I'm reading the rate per 100,000. But Farmington, at 17 is almost orange, and it will be next week. And then you look at Watertown is already orange, and that's almost yellow. So I didn't want all this red to scare the bejesus out of everybody. These reds are plummeting. These reds are becoming orange. Orange are becoming yellow at a very fast pace.
Oh, that's great help. Great help. Excellent. Okay, Crystal, I still want to get an answer about this MERV 13 filter. Should we be changing them out?
So we had a lot of discussion early on in the pandemic is how long can SARS-CoV-2 stay viable on a surface? And if that surface is a piece of plastic or a shipping box or a MERV filter, we can take the same approach. So it is not going to be viable after it stays on that surface of that filter for extended periods. So there shouldn't be concern about then handling that filter. The virus itself, once it's accumulated, deposited on within the filter, it's not going to saturate it. So really take away significantly from how it operates. So there's no need to change the filters more than perhaps 3 to 6 months, depending on what the air quality is otherwise. So do you have a lot of particles in the air, a lot of dust? So we talked previously about ceramic studios generating dust. And in those cases, I would say change those out every couple of months. But otherwise, if it's a relatively clean space, especially with some parts of Connecticut with pristine air quality, then those can stay in there for 6 to 12 months without a problem.
Excellent. Thank you so much. Judith, I think you wanted to ask another question about sanitation.
Yeah, we're still unsure is how much we should be sanitizing our spaces pre-use and post-use. How much of that is necessary right now?
You know, the sanitation was a theoretical issue. We never had data from early in the epidemic that suggested that people who touch their eyes more or their mouths more are going to get infected more, or that surfaces. It was theoretical because respiratory viruses settle on surfaces as you breathe, as you cough, as you sneeze. And in theory, you could touch that surface and touch your face and self-inoculate. The weight of the evidence now, 2 years into the pandemic, is we just haven't seen a lot of evidence that surfaces are there's a respiratory virus. People get it through respiratory means. And there's still a theoretical risk. So I see no harm in wiping down surfaces that people are repetitively touching, like doorknobs or door handles. And I see no harm in keeping bathrooms a little cleaner than we used to. But I don't think we're getting much out of these misting of the seats of the auditorium and wiping down every imaginable surface. I think there's a lot of effort for very little gain. That's my view, but I'm not the environmental health science guru of the universe. So let's ask Crystal what she thinks.
I think that response is spot on with how I would have shared.
You see, I've been your student now for 2 years. I'm finally getting it.
That's great. That's great. Crystal, I don't know what this question means, so I'm going to have a struggle even asking it. Are Corsi-Rosenthal cubes effective at filtering air of coronavirus? If so, what square footage does 1 unit filter? Does that mean something that we should try to convey to all of us?
Yes. So these Corsi roses and hell boxes are the name that has been given to the cubes, the DIY air filter cubes that we've been talking about. So right from the very start of when we were having these webinars, we started talking about DIY approaches, fixing that box fan with the filter, the MERV 13 filter on it, or if we had a very large space, we could assemble it into a cube. And we had those really nice graphics that were made from the School of Public Health Communications team that Eric, you've been so gracious to share with everyone. And that's been the name that's given to those cube boxes. So they allow for a very high amount of flow to then be pulled through the filters through the fan. They are now being tested within laboratories in different schools and various spaces, and have been shown to be very effective, and in many cases much more effective, just like we've talked about in all these webinars, than the commercially available units, because the fan is just able to pull so much more air through the filters.
Excellent. Oh, good. So it has a name, and
it has a name.
We'll keep pushing it on. Okay, that's great. That's wonderful information. So stay the course with those great cube filters. Excellent. John Carl, did you want to pose a couple questions here?
Yeah, good morning. In the coming months, we will be hearing about new variants and changes in hospitalization and positivity rates. That's at least what the course has been over the last couple of years. What kind of pandemic indicators should we use to help us make decisions about whether we should wear masks, show proof of vaccination, et cetera?
Yeah, John Carl, great question. I'm very keen to hear what CDC is going to say. As I said, they are fairly conservative. And if they say evidence for the utility of masks at certain thresholds is really minimal and you don't need to use it, I would take that seriously. I think they have a small army of epidemiologists poring over the data, and I think they're going to be giving good advice. Our state Department of Public Health is already working with the school districts, helping them. The state map that I pulled up a moment ago, and you have the link in the web, is actually helpful for school districts now that we've decentralized decision making. Because if you don't have any local circulating virus, the need for masks is really quite modest. So I think that at various points, various arts organizations can also look, where is our catchment area? Are we pulling in from the entire state? Are people driving in from Massachusetts or New York to come to our events? Or are we mostly serving a local constituency? And if our local circumstances are really highly favorable, we can forego masks. Now, in some ways, that's ridiculous, because all arts organizations pull from a wider area. So then that's why I recommended earlier we be a little cautious for the next month. Let's let these red light districts get into yellow, where that was a joke, where we can have a better handle on consumer confidence. And we might even put a picture, take a photograph of this and put a picture up on our screen, our computer screen, as you come into the museum or into the arts organization. Say, take a look at this. This is why we're foregoing masks, because risks are really minimal in our neighborhood. And that's the kind of consumer education that we may have to do.
Thank you. Building from that, what kind of processes would need to be in place for continuous risk assessment and sort of prompt decision making regarding policies and mitigation as we go forward?
State Department of Public Health, the website that I shared is a pretty good source. Eric and I are happy to work with Crystal and all of you on the board to provide some guidance to the arts organizations. We can send an email around saying, well, here's where we are, here's what CDC says, here's what the state says, and this is a highly favorable time to reconsider mandatory mask use in the facilities. I'm going to just tell you that the spring break for the kids, we're still vaccinating a lot of kids, and if you look at this map and how quickly this map that I just showed you was all red a month ago. Almost every doggone township was lit up in red, and now it's half red, and a lot of the reds are very close to kicking into orange, and a lot of the oranges are very close to kicking into yellow. So I think we're going to have some nice mapping of the average daily rate of cases. Positivity rates have already plummeted. We're at 1% in much of the state, which is really low, and hospitalization rates have already plummeted. So I think give us a month, and I think we're going to be in a much better situation.
Thank you.
Well, thanks. Yeah, absolutely. So we have a question in the chat that I think it's worthy of us taking a really close look at it, Sten. According to the OC register in LA, Omicron has morphed into distinct subvariants, including stealth Omicron, which might be even more infectious. Knowing 3 people still in the hospital with complications from the virus, it's hard to be comfortable with easing up on the mask mandates. This is where we were last year, and even with vaccines, look what happened. Any assurances for those who are not convinced?
Well, I agree with that. I mean, I'm saying that if I were doing an event tonight, I wouldn't change anything.
Okay.
So I agree with that. I think caution for the next month is very prudent. And there are just too many red lights on this map, and too many patients still in the hospital. We're still at the tail end. What I'm trying to do is prepare you for a month from now. But I think it's prudent to be cautious for the next month, because we're not out of the woods yet. And the trends are so favorable, and they're so rapidly shifting towards the good, that I think that in planning for the arts, say in the spring and summer, we don't want to be in the position where we're demanding, only every third seat be occupied, and we're checking vaccines, and we're demanding masks when essentially there isn't any circulating virus. But that is not today. There still is circulating virus, and I think stay tuned. I think that the likelihood of herd immunity phenomena kicking in, of really minimal transmission being the order of the day in about a month is probable. So I'm trying to help you all plan ahead to that time. But I
think
agree
that's
with
so
the
important
comment.
for us to think that way, to think, okay, we have 2 really orders of business. What am I doing tonight, and what am I doing in a few months or even a month? And I think I really appreciate you outlining that for us, because really, I feel it in my office. I think many folks do. We're still splitting our time from home and in the office, and trying to keep not everybody in the office at the same time. And sadly, audiences are reluctant right now. They're just absolutely reluctant to come in, and so consumer confidence is just not where we want it to be at all. We're hearing theaters at we've always had this problem in a theater. At the night before the show, we say, we have too many tickets, let's find people to come. And so and I'll say paper the house a bit, and that doesn't work these days right now. It just doesn't work. So sounds good. We've got something coming here in a couple of hopefully a month or soon. And I actually, this all lends itself to Sten, what you're saying today is that we really need to hear what's going on with CDC, which means to me, I think we should be planning a webinar shortly after all that information comes out, so that we can all plan together again based on this, because your guidance from you two is just so valuable. So thank you for that. So the question, we just keep maybe framing it over in a different way, but here's one that came to us, which was, what assurance, hope, and encouragement can we give our consumers? So, I mean, we just heard, let's listen to CDC. Should we continue to offer, masks in the lobby for those who need it, and promote that, or do we start to say the doors are open? And I'm thinking a month from now. I'm not.
I really think that we should not stigmatize or discourage anybody from using masks. And if I come to one of your events with my wife and I'm sitting next to somebody I don't know, I might wear a mask. Now, I'm a healthcare worker. I'm used to wearing masks. I've been wearing masks for 40 years. And it doesn't bother me, and I don't think it's that big a deal. And when I'm in close proximity to somebody, and if I'm in a theater, I might just choose to wear a mask. But that doesn't mean that masks should be mandated for everybody in the theater when there's no transmission. So that's kind of where we are, that masks become voluntary, and that it's quite plausible that many of our patrons will continue to wear masks, and that's fine. They're looking for one layer of extra caution, even in a very low transmission environment. Why? Because coronavirus is not something they want to get, and because we've had this negative experience over the past 2 years, and that's fine. But what people can do voluntarily is not what we mandate as theater owners or as music directors. That there's a difference between mandating something when it's not really necessary and encouraging its use if people feel comfortable using it. I haven't been the great champion of libertarian philosophy in the middle of a pandemic. I've been a great champion of saying, you should wear masks, you should get vaccinated, etc. So when I say, hey, we can liberalize, you can kind of take that, with the context of who's saying it.
That's great. I mean, excellent. Exciting for us all that we're headed that way. What kind of, I'm trying to paraphrase a question that I've heard a few times, which is, how do we encourage people to feel what you just said, which is it's okay to wear your mask even if everyone else in the room is not? How do we, I even think a few years back, you'd see somebody wearing a mask on a train or something, and you'd think, wonder why they're wearing a mask. And how do we help people feel confident? It's okay. Just wear it if you want to.
I channel my work in Asia. I've been working in Asia since 1995 with a variety of projects. Lots of people wear masks in Asia all the time. Now, their main motive was air pollution. But mask use is a normative behavior in many, many Asian countries. It's now a normative behavior in airports and airplanes, crowded spaces. You're in a tube flying, 25,000 feet above and even though Crystal will tell us that the airlines are doing a very aggressive job with air exchange and air quality, it's still normative to wear a mask when you're, huddled with the person next to you. And I think it's fine to wear masks much more often than people used to, because it cleanses the air that comes into your lungs. And it may be that you're going to wear a mask to cleanse the air for indoor air pollution or outdoor air pollution. But at the end of the day, to screen viruses is not an irrational thing to do. But when we aren't circulating coronavirus to the point where we force mask use, then it becomes optional, and I think people should feel comfortable using masks.
Great. Okay, good. Thank you. All right, so let's talk about boosters. When we talk about vaccines and we talk about boosters, are we still, do we think that there are boosters still to come? And when we're actually tonight in our concert, so to speak, and asking for their vaccine card, are we still saying you must have a booster as well?
let me just say this. Omicron and the cohort studies of vaccinated people make it crystal clear that standard vaccination is 2 doses and then a booster. Just like for hepatitis B vaccine, where the standard approach is get a vaccine, get another one in a month, and then get another one in 6 months. Coronavirus is pretty much just the same. So everybody should get a booster. Just that is now part of standard vaccination practice. And guess what? Boosters are amazing in their ability to help us diversify our protection against a variety of variants. So there's a paper from CDC just yesterday that said that infection rates were much higher in non-boosted people for Omicron than for boosted people with Omicron. And I think everybody needs to get boosted. And it's amazing what boosting does. It diversifies your immunologic ability to handle a variety of variants. And it also seems to last a lot longer than people realized. So I don't think we'll be getting a booster 6 months after our previous booster. It may be that we don't need a booster for a couple of years.
Super. That's
a lot of data coming out very recently on this, and it's all very good news for boosting.
Fantastic. Can we talk about shift over to quarantine for a minute? Darren has a question about quarantine.
Sure. So with the CDC says, 5 days in terms of quarantine, but students at UConn have to quarantine for 10. How do we reconcile the different guidelines, and how long should our staff, artists quarantine if exposed to COVID or if contracted COVID?
5 days is plenty. 10 days is overkill. And there's some evidence that 3 days would be enough. So 5 days, as per CDC guidance, is a good rule of thumb.
So I don't think we've asked this question on this webinar before, but when in the sports world, they have after your quarantine, then you have a return to play protocol where you can ease yourself back in. And I understand that's about the health of the actor. I mean, of the sports figure. But I would think actors, singers, dancers, all of those other folks may have similar challenges. Do you feel that we should be helping our artists ease back in, or after 5 days jump in?
I like testing. Testing is very informative.
Okay.
Always has been, always will be. And if I have had a close encounter with the coronavirus kind, I would think that if I'm free, if I test negative at 5 days, I'm negative. End of subject. Don't worry about it.
Okay, great. Excellent. That's a big question in the sports world. So thanks for helping us with that.
Sports world, arts world, same thing. We're all deal, together, right? Breathing on each other.
Excellent. Let's see. We have another question. Oh, Crystal, I think you answered the cubic feet question. Do you want to answer that online so everybody can hear that question, hear the answer to your cube question?
Sure. There was a question about what is the square footage of space? So what size of room is enough, or how many of these DIY units should be placed in a space? So rule of thumb, if you go out to a hardware store or off of Amazon and you purchase a box fan, when you attach that to 4 filters and you make a cube, on general, that will draw about 800 cubic feet of air through that fan. That will provide about 5 air changes, completely changes the air 5 times in a space that is about 700 square feet with 8-foot ceilings. And that's about a good level of air changes. You'll probably have just some background if you have windows open or an HVAC system operating within that space to get you up to about 6 air changes per hour. So that puts you in a good range. And then you can start multiplying those units if you have larger spaces. I've also placed a link in the chat with an air cleaning tool where you can start to sum up all the different places that you're getting ventilation from. And that will also then give you the range in which you should be aiming for, so how much more supplemental ventilation filtration you can be providing to your space to get to that optimal 6 air changes per hour.
Thank you. I think that's very helpful. We have another question here in the Q&A. That's, is there data info on transmission from returning snowbirds, especially from southern states that don't mask and encourage vaccination? Similarly, people who traveled for spring break and returned to New England.
Vaccinated, boosted people are golden. That's the key. We need vaccinated and boosted people, and their risk of acquiring coronavirus is high if they go to a big, party or wedding and everybody is unmasked, everybody's eating, everybody's dancing, and everybody's talking. But their risk of acquiring serious disease is minimal, and their risk of transmitting to others is also much, much lower. They're likely to have a much lower viral load if vaccinated and boosted. Now, if you go to Florida and you're reasonably cautious, as I was in Florida last week, because I gave a lecture at a symposium at the University of Central Florida. My younger son happens to live in Orlando, so my wife and I took advantage of the symposium. And when I walked into the University of Central Florida, everybody was masked, because the dean, as soon as Governor DeSantis said that I'm going to punish public institutions for mandating masks, but I'm going to make an exception for healthcare institutions, the dean of the medical school at the University of Central Florida said, we are a healthcare institution, even though there are no patients go into that building. But she's a gutsy lady, and she said, frig the governor, and I'm going to call this a healthcare institution, and everybody's wearing masks. So my whole day at the University of Central Florida with vibrant coronavirus transmission in the state was in a masked environment where people were taking reasonable precautions. And all of the hotels and the restaurants, nobody was masking, nobody was physically distancing, but my wife and I were masking. So when we came back, I did not feel like I was going to be a nidus of transmission to Crystal, when I saw her at work, because we are still masking at Yale. So, you can still maintain a lot of safety with personal risk reduction behavior, even in a higher transmission zone. And that's what I would recommend for our artists and our travelers and our visitors, is just use common sense, reduce your own risk with strategic masking. Everybody be vaccinated and boosted, and you can avoid this sort of cross-state risk.
Wonderful. Thank you. So I'm going to tag on your you like tests comment. So in the unionized theaters, especially in many of the other institutions, there's a lot of testing still yet to be required. For staff, I believe it's once a week. For artists, it's twice a week. The cost is crazy. So this is more of a broadcast to ask for some feedback from the folks who've joined us today online. For those in Connecticut, it's very possible that we've struck a deal with a testing institution with a donor to help us get tests to you all at low or no cost. So what I'd love you all to do, if you're in need of those kinds of tests, is to, by the early next week, get Shoreline Arts Alliance an email saying it would be super if we had 500 tests on site. that we didn't have to pay for, or 5,000, or however many it is. At the end of next week, I'm going to make my final approach to this wonderful donor to see if we can get that out in the Connecticut community. So having numbers in hand would be super helpful. So Sten, to turn that into a question, I know we've talked with these unions some back and forth, and they're going to stay proactive, I think, for quite a long time. And I should have finished my sentence. Actually, sorry, just don't let me forget that. But and I don't mean just theaters. If you need them in your offices, if you need tests, if you need 20 tests, don't be afraid to ask that from us. What are your feeling that's how long is that going to go? Like when I'm asking this question of a theater, should they be thinking a year out? Should they be thinking 6 months out for a number for us?
Yeah, I like testing. Even when coronavirus rates are low, if I'm a musician and I've just come back from Jackson, Mississippi, giving a concert, and nobody's taking precautions, rates are higher. What's the harm of my getting a test prior to rehearsals in Connecticut? No harm. Get it. Why not? We can still, we can forego masks. We can get back to normal, but we can still be doing testing. We can still be taking incoming folks from out of state, particularly higher rate out of state, and we can test. So testing is still a tool that can be a vibrant, valuable contributor to keeping the arts safe in Connecticut. And we can get back to normal, but we can still use testing.
Super. Okay, great. Well, again, you were right, Sten. It was a 2-hour conversation. We got done in an hour, or there's still left to go. But anyway, I want to thank you again, Crystal and Sten. Amazing offering that you have given to the arts community, just on and on. Just thank you.
And Eric, you're gonna capture the questions we didn't get to.
I am.
We can. Crystal and I can do our usual sort of written answers. I noticed a question from a children's museum, for example. So let's do that over the weekend and get answers back by email.
Okay, great. Well, good. We'll get some questions along your way. All right. Well, you all have a wonderful day. And be careful out there if you're in the slippery slope. Take care.
Thanks very much.
Thanks so much.
Stay safe, everybody.
Bye-bye.